Hi, my name's Hannah. I'm a trainee clinical psychologist, and today I'm going to be talking to you about my published doctoral research with Dr. Joe Daniels, which looks at predictors and mediators of mental health during the COVID-19 pandemic. So as I'm sure we're all aware, the COVID-19 pandemic has caused global uncertainty, and there's been lots of discussions and questions as to what the potential mental health impact of COVID-19 might be. Examining factors that may influence distress have been outlined as key research priorities during this time. And for our study, we wanted to focus on two potential factors that may influence mental health. And these are intolerance of uncertainty and coping strategies. Intolerance of uncertainty is defined as the negative emotions, cognitions, and behaviours that people can experience when facing uncertainty. And theoretical models suggest that this concept is transdiagnostic across multiple mental health conditions, and also that an individual's ability to tolerate uncertainty will likely influence the way they cope and respond to a situation. Therefore, the first aim of our study was to look at, does intolerance of uncertainty predict levels of distress during lockdown, particularly looking at health anxiety, generalised anxiety and depression, and is this relationship mediated by the coping strategies that people use? Secondly, we wanted to identify, has there been an increase in mental health difficulties? And by doing this, we wanted to compare to previous population norms. And thirdly, we know that there's certain groups of people that are more at risk of the adverse consequences of COVID-19 due to their physical health conditions. And we wanted to know, are these vulnerable groups more at risk of psychological distress as well? So what we did is, during lockdown in April, we put a survey online and we had approximately 842 people take part. And what we found was that rates of depression, generalised anxiety and health anxiety above clinical cutoff were significantly higher than previous normative data. So say, for example, we have health anxiety, 14.7% of our sample had clinical levels of health anxiety, compared to 4 to 6% in previous studies. We found that the vulnerable group were more anxious and health anxious than the rest of the general population. And also that intolerance of uncertainty did predict psychological distress. But this was mediated by the coping strategies that people use, particularly maladaptive or unhelpful coping strategies. So to explain this in more detail, people who struggle to tolerate the uncertainty of the current situation were more likely to use unhelpful coping strategies such as denial, avoidance, venting, disengagement, and as a result were more likely to experience psychological distress during this time. So overall, we found that 37.5% of individuals reported scores above clinical cutoff for at least one of the three measured conditions. And this is really interesting because these are really high numbers, so these are higher than previous population norms, but also figures found in previous pandemic research. So this indicates that COVID-19 is having a profoundly negative impact on the general population's mental health. And this research also helps us think about treatment implications. So we know from this research that people who use unhelpful coping strategies and struggle to tolerate uncertainty are more likely to experience distress. And these are modifiable factors that we could think about within treatment. So how can we build people's tolerance of uncertainty? And how can we help them use more effective coping strategies such as acceptance and appropriate support seeking? In addition, we know that people who are in vulnerable groups are more likely to be anxious during this time. So it's really important for us to think, how can we support these people in an evidence-based and accessible way? And these people, particularly if there's future pandemics wave, may be limited in the amount of face-to-face contact they can have. So it's really important that we've got online resources readily available for people to use. In terms of the limitations, our study was cross-sectional, and future longitudinal research can really explore the long-term impact of COVID-19. Males were underrepresented, and so our population was 80% female. And in terms of other future research, we've looked at the general population now, so now it'll be really interesting to look at more specific groups that might be more at risk, such as key workers who are working within the pandemic, and also maybe people who live with people that are shielding. What's their experience and how are they coping? Thank you very much for listening. If you want to look at the full article, you can scan the QR code that's on the screen now, and to access the paper by myself and Dr. Joe Daniels, and the reference is also on the screen. Thank you.